Grabando. Ok. Let's go. Let's go.
Okay, and medical practitioners in Britain, doctors, also known as a medical practitioner, must be qualified, have an university degree in medicine. They must also be registered, included in the General Medical Council's list registered. In order to practice, a doctor who treats a patient as an opposite to one of the only does research is called a clinical acclination. A doctor who provides primary care for patients is known as a general practitioner or family doctor. GPS and usually works in a group of practice and larger group practice work in a building called a health care center. Los médicos practicantes, los practicantes en Inglaterra, también conocido como médicos practicantes, siempre están calificados y tienen un doctorado en medicina. También están registrados, incluidos en, en, la, en la Asociación General de Medicina y están registrados para impartir la práctica médica bajo un permiso legal. Un doctor que trata a sus pacientes solamente hace investigaciones, pero no practica la medicina en sí. Y también pueden relacionarse en un grupo de prácticas, specialties. And specialties, specialist doctors, for example, pediatrician, generally work in a hospital. However, please, those who work outside the NHS provide private health care, maybe have consulting rooms outside a hospital. For example, the famous Shirley Street in London. And the two main branches of medicine are surgery and internal medicine, and the doctor who practice their branch are called surgeon and physician. Respectively, in Britain, male surgeons are addressed and nurse, miss and mistress. So, Dr. Smith is a physician and Mrs. Smith is a surgeon. En las especialidades, los doctores, por ejemplo, los pediatras, generalmente trabajan en hospitales, pero como sea, usualmente pueden trabajar fuera de ellos, haciendo trabajos extras o servicios extras hospitalarios. También se consultan en diferentes instituciones, aparte de un hospital. También se podría incluir en la famosa calle Harley en Londres. Los dos principales ramas de la medicina son cirugía y medicina interna, y los doctores que practican las ramas son llamados cirujanos y practicantes. A cardiologist, geriatrician, and anesthetic specialist is an specialist in disease of the heart and circulation and cardiology, disease of the elderly patient, or geriatrics or anesthetics. And un cardiólogo geriátrico y anestesiólogo se especializa en las debilidades del corazón, la circulación y la cardiología. El otro en los pacientes mayores y los últimos ya en caso de cirugía que incluyen la anestesia. Choosing an specialty. Joe Matthews has just graduated from medical school and is talking about her future. I haven't decided yet, but and I want to specialize. And I need more experience before I decide, but I'm quite attracted to the idea of a pediatrics because I like working with children. I centrally prefer to work with children than it says. Okay, working with children, and that says elderly patients. So I don't fancy geriatrics. I was never very interested in the late anatomy. So the surgical specialty like neurosurgery, they really appeal for me. So you have to be good to your hands, which I don't think is a problem for me, but I have assisted as operations several times and I have been done some minor ups by myself, but surgeons have to be able to do same thing again and again and again without getting bored. Like trying of cut off archers. So I don't think that it will be a problem for me, but they need to make a decision fast and I'm not good at that. I would like to have time to think and which means surgeries probably is not for me. Eligiendo una especialidad, tampoco he decidido en qué especializarme aún. Necesitaría más experiencia antes de decidir, pero estoy muy atraída a la idea de las pacientes en el área de pediatría y también y soy buena trabajando con niños. También me gustaría, lo preferiría en vez de trabajar con personas mayores. Nunca estuve interesada en la anatomía en sí o las especialidades que tienen que ver con la cirugía o neurocirugía. No pienso que eso sea algo que se aplique para mí, ya que tienes que ser buenos con tus manos, lo que no es un problema para mí. He asistido a muchas operaciones muchas veces y he hecho pocas operaciones por mí misma. Los cirujanos tienen que estar disponibles de hacer la misma cosa una y otra vez sin quedarse aburridos y eso es algo que no es para mí. No necesito que también necesitan hacer decisiones rápidas y eso tampoco es para mí. So, no entiendo o creo que la cirugía se aplique. Now I'm going to read the exercise 5.1. Write a sentence to describe the work of a specialist in each branch of medicine. Look at the opposite to help you. Dermatology, rheumatology, traumatology, pediatrician, obstetrics. A dermatologist is a specialist in disease of the skin and is a specialist in disease of the joint. A rheumatologist is a specialist in disease of the joints. Traumatologist is a specialist in accident and emergency. A pediatrician is a specialist in disease affecting or affecting children. And obstetrics is a specialist in managing pregnancies. Complete the table with words from the A, B, C, and opposite that are related from this. Put the stress mark in the front of the syllable of from the syllable of each word. First, and what has been done for you. Noun, specialist, practitioner, consultant, and assistant, and graduated. Specialty, practice, consultant, and assistant graduation qualification. Find find preposition in C opposite that can be used and make a word combination that works in the box. Then use the the C to help you. And one, a pathologist specializes in diagnosis disease through examining cells and issues. A pediatrician is most engaged working with children. An oncologist interested in the diagnosis of treatment of cancer. A pediatrist, a psychiatrist must be good at counseling, and a neurosurgeon must be good with her hands. Make a word combination using a word from each box. Two words can be used twice. Look at A and B and C opposite to help you. Surgical specialty, health center, group practice, consulting rooms, internal medicine, and general practitioner. Okay. Unit 6, medical practitioners. So, hospital staff and hospital staff. Okay, Unit 6, hospital staff, the people who work with any type of workplace, including hospital, are called a staff. And the medical staff in British hospital belongs to one of four main groups, a pre-registration. Okay, and as I was saying, a medical practitioner. So, the hospital staff, the people who work in any type of workplace, including hospital, are called the staff and medical staff. In British hospital belongs to one of our four main groups. A pre-registration house offer and or house officers is newly graduated a doctor in a first year of postgraduate training. After a year of he or she becomes registered and a medical practitioner in the current system of training, the foundation program. The name for this junior distance foundation year for one. A senior house offers in the second year of postgraduate training, the title of no foundation year to doctor. But the old term senior house offer and SHL are still used. A specialist registrator is a doctor who has completed the foundation program and is training in one of the medical specialties and are some of the non-training registers. Doctors have completed the training but not wish to specialize yet. A consultant is a fully qualified specialist. There might be some associate specialists, senior doctors, or who do not wish to become consultant. In addition, there is at least one of medical clinical director who is responsible for all the medical staff. El personal del hospital trabajan con cualquier, con muchos tipos de doctores y también centros hospitalarios. Y en Inglaterra se conoce como equipo médico. El primero es el preregistrado oficial de la casa, es el nuevo graduado en doctor en medicina que tiene en su primer año un posgrado de entrenamiento. Después de un año se convierte en un médico registrado practicante. También está el especialista encargado de una parte del sistema del hospital que está en su segundo año de posgrado y está en entrenamiento, y su título ahora es Foundation Year Doctor Second. Eh, un especialista registrado es un doctor que ha completado parte de los tres posgrados requeridos en una especialidad médica. Y un consultante es un médico completamente cualificado y que está listo para ayudar a cualquier otro tipo de especialista y legalmente es un médico practicante. Medical terms: consultant, physician, and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care of those patients. In many hospitals, there are multidisciplinary teams which consult not the only doctor, but also the physiotherapist and the other allied health professional. When the patients enter or are admitted to the hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clears them, their medical history, and examines them, and sometime later to register and also sees the patient that may be ordered investigation or test. Los equipos médicos, un consultante físico o cirujano es responsable de un número específico de pacientes en el hospital. Cada uno de los consultantes practicantes o doctores ayudan a cuidar de los otros pacientes, y también puede ser una multidisciplina en equipo en el cual se puede variar entre los cirujanos y también médicos practicantes. Cuando los pacientes son admitidos en el hospital, usualmente siguen a un doctor practicante para hacer el reingreso y ya luego abrir un historial médico a su nombre y examinarlos de la manera que sería recomendada, ya sea rayos X, invasión quirúrgica de emergencia, etc. And shift. The junior doctors now normally works in shift, which means that they're normally work for 8 hours every day, for example, 7 a.m. to 3 p.m., or are then free until 7 a.m. to the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to be on the call, available to return in the hospital if it is necessary, from 5 p.m. to 9 a.m. to the next days. Days call are set in a rota or list of names and times doctors on call party, a radio pager, a bleeper, and device which makes the noise and then someone is trying to contact them. Ok, los turnos de médicos. Un doctor practicante normalmente trabaja un shift de 7 horas, lo que dice que normalmente sería de 7 a 3 o de 7 o de 1 a 10 de la noche. También podría cambiar de las 3 de la tarde a 11 de la noche, de las 11 a las 7 de la mañana. Eso podría ser relativo dependiendo de la disponibilidad que haya en el hospital en ese momento. Now I'm going to read the exercise and make a word combination using a word from each book. Look at the A, B, and C opposite to help you. And the first one is associated specialist, whose officers one call provisional diagnosis, radio pager, word round. And 6.2, match the description 1 to 5 with the jobs. Look at A and B opposite to help you. And Dr. Graham has been pediatrician for 8 years and is responsible for treating the children admitted for ward 6. And okay, it is going to be to the consultant. The second one is that the restaurant has just started in a second year of foundation program. It is going to be on SHO, that is a senior house officer. Dr. Shine has started his training as a surgeon. This one is a specialist register. And also Dr. Phyllis just graduated, is working in a large hospital in Brigham. Is ending it is PRHO or house officer. 6.3. It is okay. And are the following statements true or false? And find reason that your answer could be. A medical graduate becomes registered for 2 years after graduation. It is false. 2. The system of training doctors in Britain are called the Foundation Program Team. The name of senior house officers is no longer in Britain. The consultant is usually the first doctor who sees the new patients. When working with night shift, all doctors fail or turns to be on account F. Okay, sorry. And as I was continuing, the exercise 6.4, complete the text for a PRHO describing her job. Look at the A, B, and C opposite to help you. When I get the word for the first thing, I do is talk of the house officer who has on duty during the last shift to find out if there have been any admissions. Then I general see the charge nurse. He tell me if there is any that needs to be done urgently and such an intravenous line is to put on the take. Anything needs to be done later in the morning. I check any new patients with basically involve taking in taking an his- taking a history on the Tuesday or Friday morning, and the consultant does her work. After that, there are usually a lot of things to do, like writing up request forms, develop, and discharge. The next day, they are usually happy to be gone to home, and there are, of course, many lectures of the training foundation. Okay, now I'm going to read about the nurses that is in the unit 7. Nurse. Nurses working in a hospital have following grades: a student nurse, staff nurse, church nurse, and nurse management. A nurse who is still in training, a nurse who has completed the training course, a more experienced nurse who is in charge of responsible for ward or department, a nurse who is charged in several wards. Support workers, and okay. Hay muchos tipos de enfermera, por ejemplo, la estudiante de enfermería, una enfermera que sigue en entrenamiento, staff nurse, que es una enfermera ya a cargo que ha completado su curso de entrenamiento y ya está calificada, una enfermera en cargo, que es más experimentada que la staff nurse, la que ya completó su curso de entrenamiento y usualmente está a cargo, es responsable de más de un departamento. Y también está la que es gerente de enfermería, que tiene más deberes de lo normal y responsabilidades en cuanto al cargo administrativo, ya que se hace cargo de muchos departamentos con diferentes tipos de enfermeras. Support workers, and the clinical support worker who has done short course and obtained a basic qualification, and the nursing auxiliary who has usually unqualified but assistant nursing staff. There are also to me clerks and whose duties include making sure patients not any information are up to date and answering the telephone. A specialization like doctors, nurse, can specialize in man and wife has specialized at the beginning of by the beginning of okay of the patients and staff and all that. But the information are not up to date and answer the telephone. El, el personal de apoyo del hospital, un personal de apoyo clínico que también hace parte del trabajo básico de las calificaciones, por ejemplo, un auxiliar de enfermería que también no está calificado, pero pueden asistir como eh, enfermero de primer auxilio y cuáles sus deberes incluidos están hacerse seguros de que los pacientes noten toda la información y que estén actualizadas y también respondiendo al teléfono. Okay, I'm sorry. As I was here, and and support workers, que